Good afternoon, everyone.
We are the second group, and we are here to discuss human capital, health, and malnutrition. Our countries are Philippines and Germany.
So, first, we're going to talk about health. According to the World Health Organization, health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Now, to address our given question, let me talk about the sickness insurance law. Of all Western countries, Germany was the first to think of social insurances that would benefit almost everyone in the country. Germany set an example to most Western countries and were first to enter a turning point for social development, wherein healthcare and benefits were given to most members of society. The sickness insurance law is a part of the social insurance development project started by Otto von Bismarck in Germany in the 1883. This law covers numerous kinds of diseases that can be contracted by an employee, employer, or self-employed individuals, with their children having the same benefits as they have. In the year 1884, they agreed that the accidents should also be covered by the insurance, and any form of injury received at work and going to and from work will be answered by the government. Austria saw the benefits of social insurances to the country's social development and were the second to implement the said laws in 1888, followed by Russia and Great Britain in 1911.
Okay, so first we have to identify the problem. There are considerable inequalities in healthcare access, possibly due to the huge gaps between socioeconomic groups in the Philippines. There is, of course, the upper class, those at the top, the middle class, those who are in the working class, and then the lower class, those who are in the poorer sectors of the country. The poor sectors of the country have limited to non-existent access to quality outpatient and inpatient facilities. So, to further explain the healthcare for the people in the poor sectors, the outpatient means that these are the patients that need not be admitted to hospitals. They can go to local centers that can be located in their barangays, for example. And inpatient means these are patients that have to and need to be admitted to the hospital for proper medical care. Major drives in inequality is the high cost of healthcare. Basically, medicine in a third world country costs more because more people in the working class have little to almost non-existent prospects for having to avail those medical needs. So, although PhilHealth, the Philippines National Health Insurance Agency, has expanded population coverage, the breadth and depth of the said coverage has resulted to out-of-pocket payments. So, what are out-of-pocket payments? Out-of-pocket payments are medical care expenses which are not reimbursed by insurance. For example, deductibles, consurance, and co-insurance and co-payments for covered services, plus all costs of services that aren't covered.
The Philippines is a major exporter of health workers, yet attracting and retaining staff in underserved areas, which are the rural areas, is very difficult. There are several reasons why this happens. One is because they do not want to serve there. Another is that the pay is not justifiable, and that the work there is hard because of poor facilities and almost primitive technology. Implementation has been difficult due to a centralized system and presence of a large private sector. It creates fragmentations and variations in quality of services across the country. So what makes implementing universal healthcare hard is having a centralized system, and the disparity between the private sector and the public sector is really big.
In line with its commitments to achieve the Millennium Development Goals by 2015, the Philippine government seeks to reduce child mortality or under 5-year-old deaths by two-thirds to 27 per 1,000 live births, which is the MDG number 4, and maternal mortality by three-quarters to 52 per 1,000 live births, which is the MDG number 5.
So, what about malnutrition? So, basically, according to UNICEF, malnutrition is a broad term commonly referred to and used as an alternative to undernutrition, but technically, it can also be referred to overnutrition. People who are malnourished, if their diet does not provide adequate calories and protein for growth and development, and for the body's maintenance, for everyday activities, and for the long run for growth, they have or they are unable to fully utilize the food that they eat due to an illness. This is what most call undernutrition. But in overnutrition, it can also be called to in malnourishment if they consume too many calories. Okay, so undernutrition has become a serious issue in the country. Most of undernutrition's targets are children in poor sectors of the population. Nutritional statuses of the population vary greatly along with the level of a family's income. So the gaps between the high income earning families and those that are in the poverty area, stricken areas are huge, and energy and nutrient intake reflect the family's socio-economic status. So as I have previously said, families with low income have smaller accessibility to nutritious foods that can sustain their children and also themselves. So as a result of this, the children are unable to grow properly into what they are fully capable of in the future. Available data show large numbers of Filipino children are undernourished. 3.6 million of children from 0 to 59 months old are underweight and 4 million are stunted. Stunted meaning that they have grown stagnant and have been unable to fully develop into what I have previously said, their proper capabilities in their physical bodies.
So why are the problems important? So basically, health is integral to development because it plays an important role in a person's happiness and well-being, which are dimensions or facets of human development. If a person is sound health-wise, they can contribute their fullest capabilities to the working force, which can also boost the economy, thus providing economic progress. So in short, if a country takes care of its population's health with a proper healthcare system, the country itself will not only experience a healthy, productive, and fully capable population, it will also be a reflection of how the government handles its responsibilities, thus honoring the social contract. There is progress not only economically to be found there. So how was the problem identified? One of the ways of the problems of health and malnutrition being identified in the country is through the NDHS, or the National Demographic and Health Survey. The program is carried out under the Philippine Statistics Authority. The NDHS program is designed to collect, analyze, and disseminate demographic data on fertility, family planning, and maternal and child health. They also gather information to estimate the country's current level of fertility, mortality, and migration, and also the factors that affect them. Aside from data gathering, analysis, and dissemination, they also help through policy formulations and activity and research monitoring. So in the 2013 Philippine National Demographic and Health Survey, among its content are fertility, fertility preferences, family planning, infant and child mortality, maternal health, child health, HIV and AIDS-related knowledge, attitudes and behavior, and healthcare utilization and financing.
So the fourth part is, was the process of identifying the problem effective? The NDHS uses 3 questionnaires: the Household Questionnaire, Individual Women's Questionnaire, and Women's Safety Module. The 3 questionnaires were translated from English into 6 major languages: Tagalog, Cebuano, Ilocano, Bicol, Hiligaynon, and Waray. Of course, the information that surveys like the NDHS have managed to gather are not as inclusive of other households, for there are unregistered people that do not fall under the radar. The NDHS states usual members and visitors in the selected households as one of the many information they hope to obtain through their household questionnaire. Those that do not have registered households will not become part of the survey basically. They also put characteristics of the household's dwelling units such as the source water, type of toilet facilities, material used for their floor, roof and walls, and the ownership of the house. These categories already eliminate the most homeless persons and the informal settlers, seeing as they do not necessarily possess these qualifications to be surveyed in the first place. Although the NDHS's efforts of translating the survey in other Filipino dialects is not only helpful and essential, it indicates that there is decentralization, which means that the NDHS makes efforts in reaching not only the usual households usually found in urbanized areas, but those who speak Filipino and English. They also reach out to those in other provinces or basically in rural areas of the country.
Steps taken to address the problem. Feeding programs and other outreach activities are simply not enough to address and eradicate health issues and incidences of malnutrition. In July 2010, the newly appointed administration launched a universal healthcare in efforts of reforming better healthcare coverage. It focused on getting more families enrolled into PhilHealth, providing more comprehensive benefits package, and reducing and or eliminating co-payments. The Universal Healthcare is a program that is used to address inequality in the health system, also referred to as the kalusugang pangkalahatan. The reason why it was implemented is for the availability and accessibility of health services and necessities for all Filipinos. It provides every Filipino the highest possible quality of healthcare that is accessible, efficient, equitably distributed, adequately funded, fairly financed, and appropriately used by an informed and empowered public. The government mandate aiming to ensure that every Filipino shall receive affordable and quality healthcare benefits. It involves providing adequate resources, health human resources, health facilities, and health financing.
The three thrusts to attain the UHC. Number 1 is financial risk protection through expansion in enrollment and benefit delivery of the National Health Insurance Program. Number 2 is improved access to quality hospitals and healthcare facilities. And number 3 is attainment of health-related Millennium Development Goals or MDGs.
So the third part are the results. There have been improvements in the delivery of key public health services, which in turn improved overall health outcomes in the country. But progress towards the health MDGs, the Millennium Development Goals, have appeared to have slowed down, especially in economically depressed communities. These also can pertain to the rural areas in the country that are hard to reach by commuting. So, regulation of goods and services has been strengthened by laws, but commercial interests continue to dominate regulatory processes. So, for example, as we have said before, the private sectors have actually been not much of a help in wanting to fully implement the universal healthcare because it gets in the way of the private and for the public health sectors. There have been a disparity between them. Despite strong efforts in the implementation of Philippine health insurance law, out-of-pocket costs have continued to increase, eroding progress towards more equitable health financing reforms in the governance and of the health system continue to be stymied by a flawed local government code that has increased fragmentation in management of health services. So as we have said before, one of the main goals of the universal healthcare and of the Philippine health insurance law was so that the population of the Philippines, especially those in the poor sectors, no longer have to pay out-of-pocket finances. But despite of the implementation of the universal health care, this incident still happens quite a lot, especially to poorer sectors of the country.
The fourth part is the strengths of the steps taken. One of the strengths of the universal healthcare is the rather noticeable effects and outcomes that results from productive and substantial partnerships between the national government and local governments. Some examples of these are seen in controlling communicable diseases such as tuberculosis, leprosy, as well as child health programs called Garantisadong Pambata. Also, in comparison with other lower middle income countries like itself, the Philippines entail better health indicators despite having a weaker economy and a large population. Life expectancy for the country shows an increase in years of life in major health indicators for children, and infectious diseases have generally improved as well.
Now for the fifth part. These are the challenges and how they were met. Access to healthcare is still limited by a person's socioeconomic status. Here in the Philippines, there are still constant financial and social barriers. This is a major weakness of the country's health system. Astonishingly, even though the universal healthcare's first and foremost goal is to expand nationwide coverage, there is still a widespread disparity for public health programs, meaning that the private sector gets to utilize the program more than the said public ones.
Go!
Remote islands in the archipelago, usually provinces, mountainous areas, and areas with armed conflicts, usually contain the lowest coverage rates for major health programs on child health, maternal care, and infectious diseases. There are almost non-existent, if not extremely difficult to avail of, medical care and assistance for these places. The government can be faulted for their insufficient efforts in reaching these places whose populations are in need of the most. Low coverages are also found in the poorest sectors of the population, which include rural areas and families with uneducated mothers, or basically all of the parents. The distribution is also heavily distributed to the availability of medical staff and other medical resources and technology.
PhilHealth is only financing 10% of the whole country's total health expenditures. Overall, financing for health in the country is still regressive in the Philippines. An effort in addressing these problems resulted in the national government allocating a larger budget for the universal healthcare. In 2011, the government released 1.14 billion pesos solely for the rural health units and hospitals. These are areas that are usually ignored and not given proper coverage by the healthcare system. This allotted fund was used primarily for the upgrading of overall delivery of its services, in particular with maternal health and the reduction of child mortality rates, in accordance with the MDGs.
Learning from the Germany's sickness insurance law, is universal healthcare effective in the Philippines? Geographically speaking, attaining the same level of social insurances as well as well-developed countries too is near impossible at our country's current condition. As we all know, a big percentage of the Philippines is still underdeveloped and still not urbanized. There are several other issues that needs to be tackled before we can fully implement the UHC. Germany, being a federal yet still unified country, was capable of implementing their social insurance laws. And since Germany consists mostly of plain type of land and is also mostly divided only by rivers and streams, it is easier to connect rural areas to urbanized areas, making health services easily accessible. The case is different here in the Philippines. The country is mostly composed of islands, and a lot of unurbanized areas in the country have weak connections with the government. Lack of roads and transportation has got to be the biggest problem that this law can possibly face, not to mention the unwillingness of medical workers to work in these areas with their lives at stake. In a nutshell, the universal healthcare system is still unattainable so long as certain issues concerning underdeveloped areas are still not answered for.